Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, we're doing another Kahoot, and we're going to be covering physical assessment of the patient. Now, before we get started, as always, I'm going to ask you to please support me and support this channel by liking this video. You're going to love it, so go ahead and give it a thumbs up now so you don't forget. Subscribe to my channel if you haven't done so already, and be sure to check out my website, nexusnursinginstitute.com. There you can sign up for a next generation NCLEX review, both part 1, part 2 sessions. You can sign up for a private tutoring session, and if you're a current nursing student and you are not doing well, you really need to get that grade up. Be sure to check out the audio lessons I have available on my website. Again, nexusnursinginstitute.com. Almost daily, you can find me covering a variety of nursing topics across my social media platforms such as TikTok, Instagram, and Facebook. My handle is the same everywhere, Nexus Nursing. Without any further ado, let's get started. Physical assessment. Okay, which pulse passes medially across the wrist? It's felt on the thumb side of the forearm. So I gave you a hint. It's felt on the thumb side of your forearm. Is it the radial pulse? Is it the ulnar pulse? Is it the femoral pulse? Or is it the popliteal pulse? Which pulse passes medially across the wrist? If you are not able to join the Kahoot, just go ahead and type your answer in on the live. You can still participate. Very good, the radial pulse. The ulnar, that's the one on the pinky side, not the thumb side. The femoral, that's the one in your groin, and then popliteal is the one behind your knee. All right, which cranial nerve is being assessed if you have the patient smell some type of non-irritating substance, like, coffee, but you're making them do it with their eyes closed because you want them to tell you what it is that they're smelling, not what they're seeing. What cranial nerve are you assessing? Is it the first cranial nerve, which is olfactory? Is it the second, which is optic? Is it the third, which is oculomotor, or is it the fourth, which is trochlear? Which nerve is being assessed? Very good. Olfactory, that is a smell. And a good way to remember it, guys, you have one nose and two eyes. So the one, which is the nose, that's olfactory. The two eyes, that's what? Oculomotor. That's where you're going to test that patient's, pupil constriction, or if they're able to raise their eyelids, you're going to have them look up, look down, look inward, right? You could take like a pen light and shine it directly in the eye so you can see that pupil constriction. Now, the third one, oculomotor, that is the one where, actually, let me back up. The first one, olfactory, that's your smelling. 2, eyes, that's actually your vision. You're testing vision. So what I told you about up, down, that's 3, oculomotor. Let me back up. 2, that's vision. So whenever you want to test a patient's vision or visual acuity, for testing purposes, a lot of the times what you'll see written on the quiz or exam, it'll say visual acuity. The minute you see visual acuity, the first thing that needs to go to your mind is Snellen chart. So that's what you're going to use to test that patient's vision. It's going to be the Snellen chart. So that's for 2, optic. 1 nose, 2 eyes. Now we're on 3. 3 is oculomotor. Now, oculomotor is the one where you're going to check the patient's, pupil constriction, where you'll shine the light directly into the eyes to see if the pupils constrict. You have them look up, look down, look inwards. You want to see the eyes move. And then last, you have your trochlear. That's going to be upward and downwards movement of the eyes. And actually, the same test you do for the optic, where you have them look up, down, you'd have them look inward, and you can also shine the light. You can do that for the trochlear as well. Now, something else that's very important for you guys to know is when it comes to physical assessment, you got to know all 12 cranial nerves. I only had spot for the 4, but you have to know all 12. You have to know the numbers. You have to know the names. You have to know what you're testing for, and you have to know different tests that you would do. Okay, you have to know all 4 for all 12 cranial nerves. So don't say I didn't warn you. The code to get in is 929-1559. 9291559. Can you guys please go ahead, type that in the live for me, please, so the people who come in late will see it? Thank you. All right, moving on to the next screen. All right, the use of fingertips for fine touch, such as, if you're checking the pulse or a node, right? The use of the fingertips for fine touch. Would that be inspection? Would it be auscultation? Would it be palpation? Or would it be percussion? I'm covering physical assessment in this Kahoot. Very good. Palpation. Now, the word here that should have made you know we're dealing with palpation, not anything else, is what word here? Where it says the use, look at the mouse, where it says the use of fingertips for fine touch, pulse node. What is the one word in this phrase that should have made you go to palpation? Very good. Touch. Touch. All right. So inspection, that's when you're looking with your eyes. Auscultation, you're listening with your ears. Palpation, you're touching. And percussion. Percussion is when you use, like, well, actually, I'm not going to say because that's going to be another screen. So I don't want to tell you what the answer is. But anyway, the point is the fact that you saw touch or fine touch, that's what should have led you to palpation and not anything else. We'll talk about percussion in a second. True or false? The temporal pulse is felt medial to the eyes. The temporal pulse, if you're looking to assess the patient's temporal pulse, you would go medial to the patient's eyes. Is this true or is this false? Correct. It's false. Think about it. Your eyes are right here. If I'm going medial to the eyes, I'd be going inwards, right? This is my nose. That's not where the temporal pulse is. So if I wanted the temporal pulse, where would I go? What's the word? Instead of medial, what would you replace this word with, guys? In the live, instead of medial, what would you replace that word with? Lateral. Very good. Very good, Sam. True or false? A small amount of blood in the stool is an abnormal finding. Is this true or is this false? A small amount of blood in the stool is an abnormal finding. It's true. You should not have any blood in your stool. Like, I put that word small there on purpose to trick you, and that's what the test writers do. Let me tell you something. Abnormal is abnormal no matter the quantity. Okay. And so the test writers will try to trick you. They will use words such as small or variable. Just they'll try to trick you. But if it's abnormal, period. Okay. You're not supposed to be bleeding out. Why is there blood in the stool? Why is there blood in the urine? Why is there blood in emesis? You're not supposed to have emesis. We don't want the patient vomiting. But if the patient does vomit, why is there stool? Right? Why is there stool in? I keep saying stool. Blood. You guys know what I'm saying. Why is there blood in the vomit? Why is there blood in saliva? So if blood is present where it's not supposed to be present, we don't care that it's just a small amount. The fact that it's there is the problem. Okay, it's an abnormal finding, and follow-up is needed. Now, when you guys get a test question asking you about follow-up is needed, clarification is needed, follow-up, clarification, confirmation, all those types of phrases, what they're really asking you is what is the wrong answer choice. During the assessment of the genitalia, the nurse should use a firm and deliberate touch. Is this true? Is it false? sometimes, or maybe? What do you guys think? During the assessment of the patient's genitalia, the nurse should use a firm and deliberate touch. What do you guys think? Very good, true. Now I'm bothered that 20 of you guys chose false and another 9 of you guys chose the other two choices. So let's talk about the words sometimes and maybe. Those are wrong. Let me tell you something. As a nursing student, when you are taking a quiz, an exam, a test, and you see wishy-washy answers like maybe, sometimes, kind of, it's wrong. Okay? Because nobody wants a wishy-washy nurse. Okay? If you don't know what the answer is and you see a wishy-washy answer such as maybe or sometimes, eliminate it. That is not going to be your answer. That leads us to true or false. And the question's asking, when you're assessing that patient's genitalia, should you use a firm and deliberate touch? And yes, you should. First of all, I think we can all agree that the genitalia area is a sensitive area, right? You guys can agree with me. So why in the world would you want to use a soft touch? Number one, we're not trying to tickle the patient. And number two, we sure as heck is not trying to caress the patient. What you mean? So yes, we're going to use a firm and deliberate touch. Why? You are a professional. You want to establish trust in that patient, okay? You want the patient to be comfortable with what you're doing. And also, you're using that firm and deliberate touch because you want to be able to assess that area and be able to, what's the word I'm looking for? I'm saying the word catch, but that's not what I'm looking for. But you want to catch any abnormalities. So you're not going to be using any, soft touch. You're going to be firm and deliberate, and you're going to be a professional with what you're doing. You guys follow me? Okay, let's keep going. Select all that applies. Palpation may be used to assess what? This is more than one answer. You're going to have select all that apply. When you're using palpation, what is that proper English? What may you be using? No. When you're palpating, what can you be assessing for? Mass, organ size, tenderness, pain, swelling, pulsation. Select all that apply. Palpation may be used to assess what? Very good, Dimitri. All of them. Very good. On the live, most of you guys got it correct. You said all of them, but I saw a couple, maybe 2 or 3 people say all of them except for pain. Yes, because when you palpate and it's painful, remember what's the patient going to do? They're either going to scream out, they're going to say ow, or most often they're going to what? Withdraw their body. And then you can assess further for what? Pain. True or false? Percussion is a tap to produce sound and vibration. Is this true or is this false? I almost gave you this answer earlier, but I caught myself. Percussion is a tap to produce sound and vibration. Is this true or is this false? Very good. It is. It's a tap to produce sound and vibration of fluids, gas, right? All right, speaking of percussion, which is not a type of percussion technique? Here are the options: direct, indirect, blunt, sharp. Which is not a type of percussion technique? Very good. Sharp. I made that up. Does exist. So you have direct, you have indirect, you have blunt. Direct is when you put your fingers on that patient, on you strike their body surface with 1 to 2 fingers, no more than two. 1 to 2 fingers, you put it directly on that patient's skin and you strike, right? That is direct contact. That's why it's called direct, right? What would be indirect? Indirect is you not striking that body surface directly. You're striking your own finger that's laid on the body surface. Okay, that's why it's indirect. Now, blunt is using a reflex hammer. So you'd use a reflex hammer like when you want to check like deep tendon reflexes, or if you want to check the patient's CVA, the costovertebral angle. What are you going to do? You use your fist. So make sure you guys know the difference between direct, indirect, and blunt. Do we percuss in real life clinical settings as a nurse? Absolutely. Absolutely. Especially if you're working GI. What type of percussion sound is loud, booming, and low pitched? It's often heard in emphysema patients. What do you guys think? Oh, your choices: resonance, dull, flat, hyper resonance. Okay, most of you guys got the correct answer. 25, hyper resonance. That percussion sound is going to be loud, it's going to be booming, but the pitch is going to be low, often seen in patients with emphysema or even chronic bronchitis. Okay, now look at our other choices. We have dull. Now that choice of dull, that sound is going to be softer. It's going to be soft. It's going to be muffled, but the pitch is going to be moderate to high. Now, just like when we were talking about hyperresonance, we see it in like the emphysema or the chronic bronchitis patient. When it comes to resonance, that's going to be what? Normal lung. That's what we expect to hear. That loud, moderate to loud pitch sound. We expect that in the normal lung. Dull sound, soft, muffled, high pitched. That's going to be what? The liver. And then last, what's our last options? Flat. Flat is going to be very soft. Oh, I keep disappearing on you guys. Flat is going to be very soft, high pitched, and that would be like bone muscle. So one more time, guys, resonance is going to be moderate, loud pitch, normal lung. Dull, soft, muffled, that's going to be your high pitch liver. And then last is our flat. Flat is going to be very soft, high pitch, and that's going to be for like muscles or bone. We're almost done, but the Kahoot pin is 9291559. We only have 12 slides. I'm going on to number 11. All right, which newborn assessment should prompt immediate concern? Would it be a heart rate of 110, 120, 130, or 140? Very good. Because the normal newborn heart rate is 120 to 140. That is your normal parameter. So 110 would be bradycardia. That heart rate's too low. You're going to have to assess your patient further. Something is going on. Now, this is a newborn. Newborns like to cry. So if the newborn is crying, we expect that heart rate to be higher. It can go up to 180 if they're crying. But if the newborn is at rest, we expect our heart rate to be between 120 and 140. All right, one more slide. True or false? To listen to high-pitched sounds, you should use the diaphragm of your stethoscope. When you want to listen to high-pitched sounds, you're going to use the diaphragm of your stethoscope. Is this true or is this false? High-pitched sounds. Very good. You're going to use the diaphragm for high-pitched sounds, like if you're listening to the heart or the lungs or the patient's bowels, right? You're going to be using your diaphragm. Now, the other side, the bell, you're going to use for low-pitched sounds, like, if you suspect maybe the patient has a heart murmur, right? You're going to put the bell very, very, very lightly on the surface of that patient's skin where the heart is to listen. Make sure you guys know the difference. And that is it. By the way, if you guys want more questions on assessment of the patient, just go ahead and let me know in the comment section. I will definitely do a part 2 if that's something that you guys are interested in. But let's see how you guys did.